So basically, in order to understand the concept of varicose veins, we have to look at the anatomy first. Okay, so this is the deep vein, tributary, and these are the superficial veins. Okay, now what happens is that we have the femoral vein, let's say. Okay, femoral vein, and then what happens is that in the femoral vein we have the drainage. We have the drainage of the popliteal vein. All right, over here, and now we have the anterior tibial vein and we have the posterior tibial vein. Okay, this is how it goes: the posterior tibial vein, the popliteal vein, and the femoral vein. And let's say this is the direction. And now in the posterior tibial vein we have the drainage of the peroneal vein. Okay, so these are all the deep veins of the leg, and this is the superficial vein tributary. Over here we are going to draw the great saphenous vein first. Now what happens is that with the femoral vein, via these perforators we have the connection of the greater saphenous vein basically drains in the femoral vein, but it is also connected to this whole deep venous system via perforators, which I will just draw. Okay, this is the great saphenous vein, and over here connected with the popliteal vein we have the small saphenous vein, but we are mainly concerned with the greater saphenous vein right now. Okay, so let's draw the perforator. Now the first perforator is going to be over here. Okay, so this is between the great saphenous vein and the femoral vein. Okay, between the great saphenous and the femoral vein, and this is called as the Hunterian perforator. Let's label it as one. One is the Hunterian perforator. It is also known as the adductor canal perforator. Okay, so basically in the leg, where will it be present? It will be present in the upper part of the thigh. When you're going to tie the tourniquet, you should know this. Okay, now the second perforator is also present between the femoral vein and the greater saphenous vein, but this is okay. The popliteal vein is going to be like a little low. I'm going to label it over here, and now the second perforator is going to be right over here. Okay, let's label it as 2, and this is basically called as the above knee perforator. Mainly its name is the Dodd perforator. Yeah, I know Dodd, but you have to remember this. This Dodd perforator, it is the above knee. So which two perforators we have seen up till now? We have seen the connection between the femoral vein and the greater saphenous vein. Okay, and between them we have studied two perforators. The first one is the Hunterian and the second one is the Dodd. Now if I'm okay, D-O-double-D. So their anatomical location is very important. Like let's suppose that this is the thigh. Okay, now this is the leg and this is the thigh. Okay, and let's say over here we have this is the medial portion, this is the lateral portion, and this is the knee portion. Now basically over here we have the saphenofemoral junction in the upper medial most part, and this is the knee. Okay, so above the knee over here we have the Dodd perforator. So over here we are going to tie the tourniquet, and over here in the upper part of the thigh we have the Hunterian perforator. Okay, just remember this. So 1 and 2. Okay, now these are the two perforators which are connecting the femoral vein with the greater saphenous vein. Now then we have the popliteal vein over here. Now this popliteal vein is also connected with the greater saphenous vein. Now what is the name of the perforator over here between the popliteal vein and the greater saphenous vein? There is no perforator. Okay, so over here we don't have a perforator. Now we're going to talk about the posterior tibial vein and the greater saphenous vein. Over here we have a perforator which is known as, I'm going to label it as 3. This is the third perforator we are studying. Okay, between the posterior tibial vein and PTV, posterior tibial vein, and the greater saphenous vein, and this is known as the Boyd perforator. And this was the above knee, so this is the below knee perforator. So over here this is going to be over here, somewhere around here. Okay, below the knee. So we're gonna tie our third perforator over a third tourniquet over here. This is the third one. And this is known as the Boyd perforator. Okay, just remember these perforators, and then between the, now we have studied 3 perforators. Now peroneal vein is also connected with the greater saphenous vein, and the perforator is basically called as the Cocket perforator or the lower leg perforator, number 4. Cocket or the lower leg perforator. Okay, this is the number 4 between the peroneal vein and the greater saphenous vein. Now basically we have a small ankle. Now this would be over here, somewhere over here, the 4th perforator, the Cocket perforator. Now in the ankle, let's say this is the, okay, now in the ankle portion we have multiple perforators, and we call them as May or Kushner perforators. Okay, I know these names don't relate to their location a lot, but this is how it is, that we have the May or Kushner perforators. These are the small ankles perforator, okay? They're above the medial malleolus, so the distance, like let's say this is the medial malleolus. So the first one will be 5 centimeter, second one will be 15, and third one, second one will be 10, and the third one will be 15 centimeter above the, let's just draw it over here. Okay, this is the foot, okay? God bless this foot, okay? And this is the medial malleolus. Now, 5 centimeter above the medial malleolus, 10 centimeter above, and 15 centimeter above, we have these 3 perforators, and these are known as the small ankle perforators or May Kushner perforators, okay? So we had the greater saphenous vein, and it was connected to the deep veins, okay? So I'm just going to write this down according to the number of perforators. Femoral vein, again femoral vein, since there are 2 perforators over here connecting it. Then we have the posterior tibial vein, okay? So the first perforator in the upper part of thigh between the greater saphenous vein and the femoral vein was called as the Hunterian perforator, okay? The second perforator, which is present above the knee, was known as the above knee or the Dort perforator. And then the perforator connecting the posterior tibial vein with the greater saphenous vein was labeled as number 3, and it was, since this was above knee, so this is going to be below knee. With respect to the position where you're going to tie the tourniquet, this is going to be called as the Boyd perforator, okay? And then I talked about the peroneal vein. Basically, peroneal vein is not directly connected with the greater saphenous vein. It is actually in connection with the posterior arch vein, okay? But the perforators were called as the Cocket perforators, okay? The Cocket perforator. And then we had the lower leg, it was also known as the lower leg perforator, okay? Then we had like a separate set of perforators which were known as the ankle perforators, and we basically said that they were present at a distance of 5, 10, and 15 centimeter from the medial malleolus, and these were collectively called as the May or the Kushner perforators, okay? So these are all the perforators. Now, so we have understood that between the deep veins and between the superficial veins, we have, this is the deep vein and this is the superficial vein, we have connections with perforators. So deep veins were the femoral veins, and then we have the popliteal vein, and then the posterior tibial vein, and the peroneal vein, and superficial vein was mainly the great saphenous vein. And now we studied almost 5 sets of perforators over here, okay? Now this is the normal anatomy, this is the normal connection. So what is the importance of this? Let's say I'm going to draw the deep venous system and the superficial venous system again. So basically, these are the deep, this is the deep vein and this is your superficial vein, and they are connected by a perforator, let's say, okay? So basically what happens is that when you're sitting, okay, when you're sitting, all the blood is usually present in the superficial venous system, okay? And when you stand, the blood basically drains into the deep venous system, okay? This is how it is, okay? Now let's say that there is something wrong with the perforator, there is perforator incompetence, okay, or there is a problem with the deep vein, the deep vein is, let's say, occluded, okay? What will happen? The blood will not be able to flow from superficial vein into deep vein, and it will basically accumulate in the superficial vein, and the superficial vein will become dilated and tortuous, and this would basically be known as a varicose vein, okay? Varicose vein are superficial, and they are cosmetically unacceptable for the patients, okay? They don't like it, it doesn't look good, and it's because of this whole pathophysiology. So now this whole condition of chronic venous insufficiency in which varicose veins are formed, this has like a whole presentation, okay, step by step it occurs. Now initially, this is also a classification system, and they're less than 1 millimeter, okay, they are known as spider veins, okay? They're not called varicose veins yet. Less than 1 millimeter spider veins or intradermal venules. This is also known as a telangiectasia. Yes, I just don't mind the spellings, okay? These are the same, spider veins or telangiectasias. Now what happens is that, let's say the size is from 1 to 3 millimeter. Now they are known as the reticular veins, okay? Now, once the size becomes more than 3 millimeter, this is a varicose vein. But the definition of varicose veins has multiple terms. The first thing is that they have to be dilated and tortuous, and then they have to be subcutaneous and palpable, okay? And then of course they have to be more than 3, not centimeter, millimeters, more than 3, like larger than the reticular veins. Basically they have to be more than 3 millimeters in diameters, and this diameter and this whole examination must be done in upright position. This is also part of the definition, that more than 3 millimeters in diameter, measured in upright position with demonstrable reflux, okay, because the walls have become incompetent. So now there is going to be a reflux which is going to be easily demonstrated by the test that we are going to do during the examination.